Today, we're answering two important questions. How does diabetes affect my feet? And how do I take care of my feet if I have diabetes? If you or someone you love has diabetes, this is information you truly can't afford to ignore. So, how exactly does diabetes affect the feet? It all starts with blood sugar levels. Diabetes is associated with high blood sugar levels, also called hyperglycemia. Over time, chronically high blood sugar can damage nerves throughout the body, especially in the legs and feet. This is called peripheral neuropathy. Peripheral neuropathy is one of the most common complications of diabetes, and it significantly increases your health risks. It increases the risk of foot pain, burning or tingling, numbness, and dangerous foot wounds. It can also lead to infections, foot deformities, amputations, and even severe conditions like sepsis. To understand this better, let's look at the three specific types of nerve damage caused by diabetes. First is sensory nerve damage. These are the nerves that control your ability to feel. When they're damaged, you may experience burning, tingling, numbness, or a total loss of sensation. This means you could injure your foot and not even be aware of it because you can't feel the pain. For example, a rock in your shoe, a shoe rubbing your skin raw, or stepping on something sharp while barefoot. Without normal sensation, these small injuries can quickly become very serious wounds. Second is motor nerve damage. These nerves control your muscle movements. Damage can cause muscle loss or atrophy and foot deformities like claw toes or hammer toes. These deformities create abnormal pressure points on the bottom of the foot, which can lead to calluses and ulcers. Third is autonomic nerve damage. These control involuntary functions like sweating and circulation. Damage here causes dry, cracked skin, an increased risk of infection, and even decreased bone density. In severe cases, it can cause Charcot Foot, where bones become so weak they break and change the foot's shape, sometimes without any pain. Now for the most important part. How do you care for your feet if you have diabetes? Here are the top 10 daily habits you should follow to protect your health. 1. Inspect your feet daily. Use a mirror to check the tops, bottoms, and between your toes for any redness or cuts. 2. Wash daily with mild soap and warm water. Always test the temperature with your elbow first to prevent burns. 3. Do not soak your feet. Soaking actually dries out your skin and can cause dangerous cracking. 4. Moisturize to prevent cracking, but avoid applying lotion between the toes to prevent fungal infections. 5. Trim toenails straight across. Do not round the corners, as this can cause ingrown nails and wounds. 6. Avoid over-the-counter corn or callus removers. These chemicals can damage healthy skin and create ulcers. 7. Never go barefoot. Always wear soft socks and closed-toe shoes, even indoors, to prevent accidental injury. 8. See a podiatrist regularly. A specialist can safely trim nails, treat calluses, and fit you for custom shoes. 9. Avoid heating pads or hot water bottles. Decreased sensation significantly increases your risk of serious burns. And 10. Manage your blood sugar. This is the most important step for preventing and slowing nerve damage. It's also vital to know when to seek immediate medical care. Don't wait if you notice something is wrong. Call your provider right away if you see a wound that isn't healing, redness, warmth, or unusual swelling. Also look for drainage, a fever, or any black or discolored tissue. Early treatment saves lives. Diabetic foot complications can be serious, but they are often preventable with daily care and proper footwear. These small daily habits protect your mobility, your independence, and your overall health. If you found this helpful, please subscribe, like, and share this guide with someone who has diabetes. If you have another health question, leave it in the comments. Stay informed, stay proactive, and take care of those feet.